Health experts have been warning about vaping for some time, but now they really want you to know that smoking and vaping can make COVID-19 worse. I'm joined now with Dr. Oliver Brooks of the National Medical Association. So thank you so much for being with us.
Thank you for having me.
Why does smoking and vaping make COVID-19 so much worse? What kind of complications are you seeing?
So COVID-19 is a respiratory virus. What we are seeing is that smoking weakens the immune system, it weakens the lungs. And so what we are seeing are higher rates of hospitalization and death among African Americans. And part of that can be linked to cigarette smoking in all populations.
And that's something that you're noticing. We wonder why we're seeing the disparity in minority communities. You think vaping, smoking has a direct correlation?
I think the direct correlation is that African Americans have higher rates of hypertension, diabetes, chronic lung disease, and smoking exacerbates all of those conditions. So when you layer cigarette smoking on top of diabetes, hypertension, and chronic lung disease, you just get worse outcomes.
Is there any difference between smoking and vaping? Is one worse than the other?
I would say they're both bad. Actual cigarette smoking seems to be worse because you're inhaling the tars into your lungs. However, vaping does have some negative effects on the lungs, and many that vape end up smoking also.
Now more than ever certainly is a time to quit, but I know it's hard for people. So how can people get help with this?
So first, we need policies that work against smoking. The tobacco industry has targeted the African American community with menthol cigarettes. So we need policies that remove flavored tobacco from the market, and those that need to quit. This is a teaching moment. You have a pandemic that attacks the lungs. Quit smoking, you can call 1-800-QUIT-NOW. Also, you can get tobacco control medications, and those should be covered by Medicaid.
Great. Those are some good resources. I know it's hard for people to do it alone. Doctor, thank you so much for your time today.
Thank you very much.